So, welcome. It's Wednesday, March 25th, 2020, and this is an update on the COVID-19 coronavirus pandemic. And I'm Ford Brewer. So, we're going to talk today about testing programs. We're going to talk about the types of tests. But first of all, let's talk about why testing programs are important. Have you had a chance to look at the different countries? Here's a good graph of how the epidemic curves happened in countries like South Korea, Spain, and Italy. As you see, a dramatic difference in how the curves happened. What did South Korea do differently? Well, these are the number of tests per person. And look down at the bottom. South Korea did more tests per person than any country. And look up at the top. The US has done the least tests per person. So what happened was South Korea and Singapore both have done a thing called contact tracing, quarantine. So they didn't depend on just voluntary social isolation like we've done so far in the US. They did testing of folks. They, for example, these guys lived in South Korea, lived through SARS. So they've been there before, they know what they need to do. We're going to talk about testing here in just a minute. So how did you like that? Clyde set that up for us, and I hope that's taking us a little bit better into a little bit better level of editing. So for today, we're going to be talking about the coronavirus update, March 25th, testing programs, the role of testing programs, virus testing versus antibody testing, and the status of the program that I'm working on right now. We're also going to talk about PPE. That stands for Personal Protective Equipment. And the quote from John Mandrola, an electrophysiologist cardiologist in Louisville, Kentucky. He's also a physician blogger. And the title of his blog yesterday was, "Some of Us Will Die." He's talking about doctors in medical centers basically saying, look, we don't have the masks we need. We don't have the other equipment either. But we still have to do our work. In fact, there were some docs saying that their hospitals were telling them, just continue to work and do not tell anyone outside of the hospital that we don't have adequate equipment. That appears to be a pattern right now, or there's certainly evidence when you begin to look around that that's a pattern. And I can tell you from the activities that we have in terms of sourcing for this upcoming national testing program, equipment is a big, big deal. So we'll end up with some comments about preventable disease. I think we know Dr. Mandrola is right. We're going to lose some very good healthcare providers. We've already lost a lot of good people, and there'll be a lot of continued preventable death, disease, and disability. But there's hope, and the hope is founded in reality. We'll talk about some of that. So the next steps. Talk about viruses and antibodies and testing. So when you look at, let's talk about the virus test for a few minutes. There's a virus test and an antibody test. The virus test is actually looking at the viral genetic material, which in this case is RNA, as opposed to DNA. You don't need to remember that. A virus test, which is what we're setting up on a national basis. It's called PCR, polymerase chain reaction. It has to be incubated for a couple of days. It tells you if you're contagious or not. The rough time estimates for viremia or virus in the blood or positive tests if you have an infection with this are typically around days 2 to maybe up to 15 during the infection process. The antibody test is different. It's the test that they're calling the quick test or the home test. There have been some scams on that, I know, but there is an antibody test that's becoming available, and it will be important as well. it looks at the human antibody. So humans develop antibodies to most of these viruses around day 14. So what does it tell you? It tells you if you're immune. So the virus tells you, the virus test or the PCR takes a couple of days, and it tells you if you have virus in your blood. It tells you if you're infectious. The antibody test takes about 2 weeks in terms of the infection, and then it starts to tell you if you're immune to it at this point and if you've been infected. So we'll go a little bit deeper if that sounds a little bit confusing. But before we do, just want to make this comment. I've said a few times that the antibody test is going to be important later. Actually, folks in Singapore have already said, look, we are now using the antibody test in terms of contact tracing as well. Here's an article about that. Basically, what they found were, as you may remember, there were 2 people, I believe it might have been a husband and wife, that were very important to a couple of meetings, a couple of church meetings in Singapore, which resulted in a lot of spread. They were able to go back, test the husband and the wife. The husband had the virus test positive. In other words, he was still infectious. They were able to quarantine him. The wife was virus test negative or PCR test negative, but she was antibody test positive, indicating that she was probably the first one of the 2 to get infected, and then shared that with her husband. So again, that helped them piece together the puzzle, which resulted in finding the cluster, finding the transmission, and helping them draw a quarantine around the transmission that was going on. That's just basic public health activity. Unfortunately, we don't have that yet in the US because we don't have enough testing available. So again, both types of testing can be used to find transmission. We look for outbreaks, clusters. We quarantine and cap off these episodes. And that's what South Korea and Singapore did. Now, this is not the first virus that we've dealt with. This is not the first virus that there's been tons of testing associated with. And in fact, when you start looking up these antibody and symptom and infection curves for viruses, you really can't find, or I haven't been able to find a good curve yet showing, even just showing the antibody development for COVID-19, coronavirus, the novel coronavirus, SARS-CoV-2, whatever you want to call it. It's just too early. I'm not finding a lot of this kind of curve. So I'm going to give you some examples for these curves using other viruses that we know. What we'll do is we'll look at the time to infection, or the time to developing spread of the virus, and then the time to developing an antibody, and put all of those in a timeline. That will then help you understand how the virus or PCR test works and compare that to the antibody or quick test or home test. It'll also help you understand the differences between the 2 in terms of use. Now, here's a typical antibody pattern. Antibodies, as you know, is where our immune system gets up and rolling, starts recognizing the infectious agent and starts developing a specific antibody or reaction against that. The first thing that we get is IgM, and then second we get IgG. Usually IgM happens about day 14. IgG, which is more specific and lasts longer. As you see, it's 1 chain here. The IgM is a 5-chain antibody. The IgG comes in at about day 21. Again, it's more specific, it's longer lasting, and it provides us with the keys to immunity in the future. That was, this one, for example, is Parvo virus, I believe. And here you see day 0, is the day you're infected. Then you start developing viremia, virus-emia, meaning in the blood. So you can measure levels of virus in the blood. It peaks at about day 14, And that's the day that IgM is getting started. And as IgM gets started, it begins to decrease the amount of virus in the blood. And over the next week, then IgG begins to get involved in terms of helping us fight that virus. Zika virus, you've heard of that? Same type of thing, day 0, and then over the next few days, you get spread of the virus within the body. You get increased viremia, virus in the blood. You start developing symptoms. Fever onset is peaking at the time of the viremia. Then you start getting development of antibodies, and as you do, fever, symptoms, and viremia begin to decline. That's a pattern you're going to see over and over and over again. Back to the Parvo virus, if you look at this a little bit more deeply, days 0 to 3 is when you have early incubation. You can't detect the virus yet, but you're starting to get virus and replication throughout the body and spread through the body parts. You get increased viremia or virus in the blood up until, again, about day 10 to 14 when IgM starts to kick in. As you start peaking with your viremia, that's when your symptoms peak, fever, flu-like symptoms. And again, as the IgM begins to gear up, the symptoms and the viremia begin to come back down. Over the next few weeks, then you're going to start getting IgG. Days 3 through 15, virus in the blood or viremia, and days 10 through 15 is when you start getting the antibody. Similar pattern, another disease that most of us have had very personal experience with, measles. This gets a little bit more into detail in terms of the spread of the virus. So with measles, you get infection at day 1, at day 0. Days 1, 2, and 3, you start getting it in the respiratory tract. Measles is like the current coronavirus, COVID-19. It's transmitted by the air, by breathing. So the first place you get infection is in the respiratory tract. The next place that goes is to the lymph nodes that drain the respiratory tract. Next, about day 5, you're starting to see the virus, measles virus, in the blood, then in the spleen, other lymphatic tissue, the lymph drainage tissue. I won't get into that. Then more in the lung, the thymus, the liver, the skin, other places. Now, as you start getting that viremia or increase in virus in the blood at days 3, 5, 8, 10, you start getting symptoms. The first symptoms you might remember are complex spots. If you don't know what those are, that's okay. And then the rash starts at about week 2. As is typical with these, we start seeing development of the IgM at about the 10-day to 2-week period. And then at about the 3-week period, you start seeing IgG, the more specific, more effective antibody. So we've talked about other examples. What about COVID-19 itself? Well, this is really all I can find right now regarding what we would call viremia, or amount of virus in the blood or tissues. Now, what it does appear at this point, it clearly appears to be consistent with what we've seen with we see with your typical virus. You don't find a whole lot in, this is a throat swab and a sputum source for viral load. And you don't really see much days 0, 1, 2, 3. But then about day 3 and 4, 5, 6, up to day 9, you start seeing significant viral load. This was in the patient 1 of this study, then patient 2, a similar sort of thing, not seeing very much on days 1, 2, and 3. Part of the question is, what kind of sampling were they doing then? But again, as you see, significant peaks at days 3 to 5, 3 to 7, and then they're starting to come back down about day 10, when we would expect IgM to get started. Now, That appears to be consistent with what we're seeing with the study we talked about yesterday from the New England Journal, talking about the median incubation period. In other words, time from infection to disease appears to be about 5.5 days. Remember, we also talked about the fact that about 95% of folks will show symptoms within 2 weeks. So again, this appears to be going right along the pattern that other viral diseases have gone. Now, let's talk again, just very briefly, comparison of the two tests. So the virus test, or the PCR, is looking at the viral genetic material. You're going to see that positives around days 2 to 15. Again, it takes a couple of days to get that one, compared to the antibody test, which you can get within an hour. The antibody test is similar to the pregnancy test. You know, you get you're going to get some available at home probably. And again, there's scams right now. I would not suggest anybody go out to look this up on the internet and find it. You'll get your money taken. But I do expect them to become available at home. The kind of testing that you see in these centers right now that are popping up all over the country are the PCR. It's looking at viremia. It's looking at the genetic material out of the virus. Because it's looking at genetic material that's just getting started in days 2, 3, 4, 5, it takes a couple of days. You take it back to the lab, you incubate it, you use the polymerase chain reaction, that's why it's called PCR, to multiply the genetic material that matches that virus's genetic material and see if it's in there. The human antibody test is, again, simpler, easier, and quicker. So I hope this has been helpful in terms of helping understand what's going on with viruses, why it's so important, and what needs to happen next. Speaking of what needs to happen next, we know what's going to happen next. John Mandrola, he's an electrophysiologist, cardiologist in Louisville, and a popular blogger. He wrote a blog yesterday that basically said some of us will die. And he's talking about docs. And you know the story, you know the situation. Here we are in the most advanced, wealthiest country that's ever been, and with the most healthcare manpower, the largest, most well-trained team of healthcare physicians and providers that we've ever had. And we're going to be putting those folks out. The CDC actually came out with statements saying, we know that people are going to start doing homemade masks up to and including bandanas, you know, like John Wayne and Roy Rogers and Gene Autry used to wear when they were shooting at the bad guys. And that's going to result in some of us dying in terms of physicians. And they know it. There's also some significant stories coming out of the hospitals that the hospitals don't have the equipment and they're telling their medical staff not to tell anyone. Whether that's going on or not, you know, I'm not an investigative journalist. I suspect it is, having lived in those spaces. It is. I can tell you a little bit more from my side what's going on in terms of our sourcing of equipment, but I'll do that in just a minute. So speaking of the CDC and their position on this, they've said, look, here's strategies for optimizing the supply of face masks. That's just in the CDC website. You can find that. They've classified this problem into 3 levels. Conventional capacity, that measures consist of providing patient care without any change in daily contemporary practices. This set of measures consists of engineering, administrative, and personal protective equipment, PPE. Controls should be implemented in general infection prevention and control plans in healthcare settings. So that's conventional capacity. Then contingency capacity. Contingency capacity is measures may change, daily standard practices, but may not have any significant impact on the care delivered to the patient or the safety of the healthcare personnel. These practices may be used temporarily during periods of expected face mask shortages. Then we have crisis capacity. Strategies that are not commensurate with U.S. standards of care, these measures or a combination of these measures may need to be considered during periods of known face mask shortage. And they go into some of the other suggestions. The next to the last group of suggestions was consider using ventilated headboards. I'm not going to get into what that is. And then healthcare personnel, HCP, use of homemade masks. In setting where face masks are not available, HCP may use homemade masks. For example, a bandana or a scarf for care of patients with COVID-19 as a last resort. However, homemade masks are not considered PPE since their capability to protect healthcare personnel is unknown. Caution should be exercised when considering this option. Homemade masks should ideally be used in combination with a face shield. At least use the face shield, which covers the entire front that extends to the chin or below and sides of the face. Well, in terms of some of the own, we've had some of the same challenges everybody else has had. Originally our lab would say things for a couple of weeks like, we've got capacity for 4 million test kits per day. That'll be coming up line in 2 weeks. Then last week they said that. And then earlier this week we heard, well, we've got a total of 5,000 test kits. These are meant to last indefinitely. We are getting geared up, but we'll have to parse these out to use you and others. That was this past week. Then we go to, well, one so frustrating. Okay, thank you, Clyde. It is what it is. We'll continue to move on with that. How can you see the screen?
Yeah, you can see the screen.
Okay, so where we were was we've gone from we supposedly will have 4 million test kits available per day to we've got a connection that has a connection in South Korea. He says he's got a lot of them, but he wants cash up front. So obviously that doesn't sound very encouraging. We've developed further capacity, but again, we're having everybody's having challenges right now. We talked recently in a couple of other videos about the CDC guidelines for coronavirus testing. I'm not going to go through that whole section again right now, but we'll give you just a couple of comments. Here's how to find those guidelines. I'll tell you a little bit about how to find the guidelines, what they say, and why they loop back to practical symptom management. So you can go to this, this link, cdc.gov coronavirus 2019 NCOV cases updates testing in US.html, or just Google CDC coronavirus testing. And the first choice that comes up in the search engine result page, the SERP, item number 1 should be coronavirus testing with CDC, the ones that we're talking about. As you see, they will go into, this is the page that you'll find. You'll see that they talk about symptoms and testing. You click on that, you can go into testing in the US, and that testing will take you a little bit into a loop. Instead of taking you into discussion about testing like I've been having over the past few minutes, it takes you more into symptoms, a symptom checker, and helping you understand that if you have serious symptoms like difficulty breathing, severe chest pain, then you need to get immediate emergent care. and not worry so much about getting testing. So there you go. Why would they do that when they're in the CD section on testing? For the same reason and the same problems that we just brought up. They know testing and test kits and the PPE to do the testing are at a major, major shortage right now. So back to John Mandrola's comment. Again, some of these people will die. We know that. And again, we've got heroes out there who are seamstress heroes who are out making masks out of materials that were just, I'm sort of struggling, obviously. So we've got some heroes out there doing a lot of good work. They're also making gowns out of Tyvek house wrap. But here's the thing, we know a lot of people are going to be dying in the healthcare area. We know a lot of people have died already in healthcare as well as outside of healthcare. If you look at our trends, we're back on a major uptick in terms of cases globally. Most of the people that are watching this have seen things about the New York lack of containment right now. And you can see it here on this picture. So there's going to be a lot more that die as well. We've had plenty of warning. That's what's one of the things that's majorly frustrating. This is a picture of Michael Holmes in his book, Deadliest Enemy. You go to chapter 13 and it talks about SARS. This is the picture of SARS, a diagram above it where SARS is one of the coronaviruses that's now endemic in the camel population in the Middle East. And the WHO has been checking for humans. We've expected this to cross over into the human population, and it has several times already. That's what the SARS outbreak was. That's what MERS was. Chapter 13, Deadliest Enemy. And this is only one of many warnings that we've gotten. He was talking about SARS and MERS, harbingers of things to come. And he starts it with a quote, "And the dawn comes up like thunder out of China across the bay." Quote from Rudyard Kipling. So, yep, you know what? A lot of people are going to die. We had warning. We didn't heed the warnings. But you know what? This is not the only time this has happened. You know, I live in that world. I've lived in that world my entire professional career. In fact, for the past, 10 years, I've focused mostly on heart attack and stroke prevention. And guess what? Every week, 30,000 people in the US die from heart attack and stroke. The vast majority of these are preventable. There were 250,000, I think, that died in the Vietnam War. So we're getting another Vietnam War every, 2 months? And it's preventable. And we are warned on a daily basis, and we ignore the warnings. So welcome to my world. So things don't look good right now. Obviously, you've seen this before. We've all seen it. And you get the little cartoon with the frog that's being swallowed by the stork, and he says, he's doing everything he can. He's squeezing the stork's throat, and people say, you know what? That may sound cute. It may sound, quote, inspirational, but it's really not reality, especially if you're the frog looking down the throat of a heron. But you know what? That's what some people like Neville Chamberlain said about Winston Churchill when he said, don't give up. So we need to not give up. There is plenty of hope. This is not the first preventable disease that we've let happen. This is not the first time that we've had a huge number of deaths. This is going to happen. The deaths will happen. The disability will happen. The unnecessary infections will happen, and then we'll move on. We're going to start. I don't know if it's going to be. I don't think it's going to be two weeks, but we'll have a very different world here 2 weeks, and we won't have people having to preach about staying inside. It'll become very, very clear why we need to stay inside, why we need to focus on prevention. hopefully next week, I've had a few commenters talk to me about, well, doc, you really didn't focus enough on stimulating the immune system with things like supplements. Yes, supplements help. I've got dozens of videos on supplements. They help with the immune system for the cardiovascular disease. It makes every sense and reason to believe that it would help for this disease as well as any other disease in terms of the human body repairing itself. That's the most important thing that we have. You go back in this specific set of slides and you saw multiple times what really saves us is our immune system. We get that increasing viremia, virus in our blood, starting anywhere from days 3 to 12, and then at days, starting around day 14, our immune system kicks in. So there's research on that specifically. BCG, Bacillus Guillaum, I can't remember the BCG, Guillaum-Gaumet, something like that. The BCG is a vaccine. It stimulates the immune system. It has been used in the past mostly outside of the U.S. as a stimulant for the immune system for decreasing tuberculosis. There's a lot of research, a lot of focus right now when you look at the internet. Guys like MedCram, the MedCram channel covered that the past couple of days. And hopefully I'll get a chance to get into those in some of the next videos. Thank you for your interest. We'll go and see if there's anybody asking any questions. So here we go. Yes, quite a few. Hull 39. If high serum zinc does not raise cellular zinc unless another medication is used, then why take zinc when on an ACE inhibitor? Well, again, I think the goal is to take zinc with some of the ionophores. And you may remember one of the critical ionophores is quercetin. And you may remember, we covered this, I thought we covered this in the video yesterday. Quercetin is a plant flavonoid. What does that mean? You find it in fruits. You find it in plants in your diet. So those of us who are on a carnivore diet really need to be focused on getting flavonoids. Look at something like maybe adding fruits back to your diet, figs. Those of us who are really worried about carbs, blackberries, blueberries, raspberries, all of those have flavonoids in them. So make sure that you get those and get zinc and supplement with zinc. As I've shared many times, one of our volunteers sent me some zinc because I was complaining and whining that I had run out. Kevin McCord, thanks for attending again, Kevin. Kevin is a great preventive doc up in the Cincinnati area. Thanks for the timely update. Sounds like we still have a long way to go here in the U.S. Yep, in regards to widespread testing. Yes, we do. Laura Rance, greetings from Texas. What do you think about humidity and heat killing this virus? I don't think there's that's a good plan. They recently did a study on going back to the Diamond Princess. They found stuff on equipment surfaces after what, 2 weeks already? So, if you use things like hydrochloric acid, it does kill this. This is not an incredibly strong virus, but just depending on heat and humidity, I don't think is very good. Kevin McCord again. Kevin, could you comment on the use of split ventilators? I wish I could. I saw that comment. Sounds as though they're using a single ventilator to support 2 patients while somehow keeping all the tubing separated. As people get really worried about things like mixing air and where's it going, and I'm not quite so concerned about that. I'm just concerned about doing having a a totally unprecedented new process. But you know what? Looks like we're going to have no choice. Very, very interesting topic. Wish I could give you some more information on that. Thomas Russell, does multiple exposure lead to higher viral load than and therefore more severe illness? Concern for doctors and nurses. I don't think we know that. I think bottom line, either way, what you're doing, even if you get a lower exposure, then it takes that virus a few more days to get up to the viremia, the higher load that causes disease. So I'm not actually convinced that that's really going to cause more of a stronger disease. I'm just guessing from what I know. But what it will do for sure is create the disease quicker. It'll get them to that tipping point for symptoms and viremia a lot quicker. So, Robert Pinsky, can you explain the rash? Does the coronavirus have a rash also? Well, I mean, if you're talking about the rash that happens with some of these other viruses, it happens because you get infection in the viral infection in the skin. You get inflammation that causes redness and things like that. Rash has not been a major component of coronavirus, at least that I'm aware of. You have GI symptoms. The biggest thing, GI meaning gastrointestinal, the biggest thing by far has been the respiratory symptoms. Linda Alexander, I read that the measles virus is more contagious than COVID-19. It sure is. It's like, what was measles? I think COVID-19, we still argue about whether it's 2.5 or 3 and this setting, et cetera. And isn't measles something like 12 in terms of the R naught, the reproduction factor? Far more infectious or contagious than anything I know of. So is that true? Yeah. Mass inoculations have kept it down. Yeah. Again, it gets to that whole thing of herd immunity. And I know a lot of people don't like to be referred to as being part of a herd, but again, a lot of us just say moo. Yes, herd immunity is a major protection factor for us. You get to those folks that are vaccine haters and refuse to use vaccine, quite often they still themselves or their kids still miss getting the infection. And when they do, it's simply because everybody else has taken that hit, taken the vaccine, and created that herd immunity. But again, something like measles, it's hard to imagine herd immunity just being enough because it's so infectious. Ken Patu, Larry Griffiths, I heard there are 3 strains of COVID-19 now. Yes, I'm not surprised. I expect we'll get a couple more. I mean, all of these viral diseases, as you see, a virus is nothing but a quote, living, end quote, hypodermic. It's got the protein and glycoprotein core, and on the inside, it's got the mechanism for hijacking our cells' genetic material. So this is nothing but a genetic replay. With all that genetic replay, you're going to get some miscommunication, misreading, and that, by definition, is a mutation. And those mutations will happen as this pandemic continues. So, Ken Patu, N95 mask shortage is a failure to plan, unforgivable. Well, you know, like I said, we're going to have we've already had a lot more people die this year from the regular flu, and we routinely have more people die from heart attack and stroke. And those have major failures to plan components as well. So, yeah, we don't prevent very well. We don't plan very well as a species. PCG, I'll take 70%. Not sure what that means. PCG N95 shortage is due to relying on China for your medical supplies. Well, I think there's a major debate and focus around that. And, you know, the last time I mentioned what one of our political leaders said, I got pilloried. I think one of the things that our non-medical leaders are saying is, look, we cannot depend on China for critical supplies. And I think we're living through some of that right now. Larry Griffiths, the Lone Ranger rides again. Yeah, unfortunately. And I think the Lone Ranger's bandana was about as much protection against bullets as bandanas are going to be against the coronavirus. Eric Jantz, experts in Europe say when being infected 24 hours after you feel recovered, as in no more fever, no more cough, you are immune and not able to infect others anymore. Do you have the same perspective on this? Well, again, Eric, if you go back and you look at the viral load and the antibody patterns that I showed earlier, that's the pattern that we see over and over and over again. Now, are there exceptions? Of course, there are. HIV is one of those exceptions. You can still be infectious afterwards. I don't think this is turning out that way. If you look at whether you're a CDC hater or not, if you look at the CDC's comments, the last time I looked, one of the number 3 of their top 5 items, believable facts, is that once you're done with this disease, you're no longer contagious for it. You no longer spread it. So I think that's true. I've heard several stories, mostly from Chinese government TV, that that you could get reinfected and that you could spread it again afterwards. I haven't seen anything from any kind of credible source saying that that's true. Is it possible that you could have 1 or 2 where these are happening? Of course, that's possible. But that's my expectation, that once you get over and beyond this, you won't be contagious. You won't be able to infect others. Okay, so this one is not showing up. Larry Griffiths, if we reduce cases of severe flu, then more ICU units are available for COVID-19. Exactly right. Exactly right. So failure to plan for the regular seasonal flu, failure to get the flu vaccine is compounding the problem with COVID-19. And to that point, I'm not doing a lot of primary care these days, or at least I haven't been up until recently. I've been focused mostly on heart attack and stroke prevention. And, but I still talk to guys like Kevin McCord and other folks who have a significant component of primary care. And all of them are saying the same thing. Kevin, David Wright, others. Yep, we got a lot of people with the regular flu, and 90% of them at least got the regular flu and said, yes, I did not get the flu shot. So you're right, Larry. Those folks are helping it make it more difficult to manage the COVID-19 pandemic. Larry Griffiths again. So far, 16,000 people have died and 280,000 people have been hospitalized during the 2019-2020 flu season, according to preliminary estimates from the CDC, February 1st, 2020. Eric Jantz, Dr. Brewer, do you have any idea of what the average ICU time is for corona patients that need to go to the ICU? No, I don't. I have read it. I've read conflicting statements. Most of them have been on the side of saying this is taking a little bit longer than you might have expected to get them weaned back off of that respirator and back out of the ICU. But again, what's happening is the inflammation is filling the lungs up with fluid, and it's taking time to get those lungs dry again so they can breathe. Kevin again, Dr. McCord, unfortunate when some public officials overpromise and underdeliver. Well, yeah, it's lethal when that happens. And when overly optimistic conjecture obscures the reality of facts and data for the sake of public opinion or political gain. Yep. So Bob Weiss, well, we had something on Bob Weiss, and then again, this is, sorry, it skipped over a lot of comments, guys. If I'm missing your comment, Please accept my apologies. Hot Wheels, go Brewer. Thank you. Bob Weiss, North Georgia Mountains, the dentist in Georgia printing a mask. Filter is attached to the front, easily changed, uses dental putty to seal. He's making the file available. Well, good for him. And our friend in Cyrillic script from Russia, the Kiev, I hope things are going well there. Low serum protein 60, normal albumin, indication for low immunoglobulins. Not sure of the question. D's 2 row. What about vitamin D from sun exposure? Vitamin D has always been helpful in a lot of places. We always thought that vitamin D in the past needed to be between levels of 20 and 40. As you know, a lot of people thought some doctors were kooky when they were saying, no, that's actually a relative deficiency. I think that battle has, for the most part, finally been won in the science and the literature. Higher levels of vitamin D3 are better. They do help with things like warding off and decreasing diabetes, which, as you might remember, is one of the major risk factors for serious disease with COVID-19, because prediabetes and especially significant diabetes decrease our immune function. So yes, you'd have to follow some chain of events and you have to think in a causation type of manner. But yes, vitamin D3 is very important. I got a comment from again, several comments from several people saying, Doc, please mention supplements and things like vitamin C. Now, again, there's been a lot of hot debate right now about how important vitamin C is. I would clearly take vitamin C. You should have it in your multivitamins. And again, just like everything else, when you look at cardiovascular disease, you look at other diseases, you can't medicate your way out of a bad lifestyle. You can't supplement your way out of a bad lifestyle, but sometimes each one of those helps. Just like you can't stent or surgerize your way out of a bad lifestyle for heart attack and stroke either. But sometimes they help. So Larry Griffiths, the SNS signals the adrenal glands to release hormones called adrenaline, epinephrine, and cortisol. Well, yes, correct. Felix the cat. I wonder who else remembers that. Are there any updates on ACE inhibitors? No, not yet. Not that I've heard of. I think the jury's still out on whether to take them, not to take them. And I'm clearly in the mode of saying I'm still taking mine. And I'm not changing until and unless I hear an update which would indicate that I should. I was reading up, and ACE inhibitors do not bind to ACE2. Have they done any data mining to see if the severity is higher on on patients with ACE inhibitors? It seems like it would be simple enough to get that information out, doesn't it? And I expect that probably to happen over the next week or two, but I have not seen anything yet. Obviously, if anybody does, I would love to see and hear it. Larry Griffiths, any research on UV light? If UV light kills the virus and what UV light wavelengths would kill it? I have not seen anything on that. I have seen, again, it's very susceptible to very simple, extremely common household cleaners that include things like hypochlorous acid. But again, that's that's about my level of knowledge at this point. Rich SJT, is it appropriate for a family physician to order the BCG vaccine for a greater than 60-year-old with low EF, low ejection fraction? That's a really good question. That sort of catches me by surprise. From my perspective, given what's going on right now, I would not, I'm not familiar. You know, I used to study the BCG vaccine quite a bit back in my earlier public health days. I don't remember a huge amount of bad side effects from it. So, you know, you're weighing maybe not a whole lot of side effects, but still very unproven benefit. William Perry, good to hear from you, William. Can a CPAP help with breathing problems? Turn up the pressure. A lot of folks have asked that question. I'm a little bit skeptical that the CPAP is going to create the type of pressure, and B, controlled the way it needs to be to help in this space. So I'm not putting a lot of hope on a CPAP. Hi from Florida, Z50, Z6. I wonder if, that wouldn't be Tracy, would it? The Corvette nut fan? Okay, so let's look. Bob Mester. I heard about a week ago a report, I believe was from China, that people with blood type A were a higher percentage of patients. Do you know any more about that? I don't. And that would be a surprise, but it would be a very interesting surprise if it had it. A. Schultz Noon said that. William Perry again, is there any reason to believe it takes multiple years to get a vaccine for coronavirus that is not as effective as the current flu vaccines? Well, you've heard it multiple times. It's not the sequencing of the virus that takes time anymore. It's not the development of the amino acid sequence for the vaccine. What's taking time at this point is the testing of the virus. So, I mean, the testing of the vaccine. So, at some point, if this continues to be as dangerous as it is right now, you might begin to start thinking or see some rethinking about the clinical trials for this pandemic, including the clinical trials for the vaccine for this pandemic. If you've got known very high rates of disease, death, and disability, and you've got unknown levels of potential problems with the vaccine, you may see some. I suspect we may see some accelerated testing for vaccines. Rita, I have a question that's not about testing, but hope you can address another day, if not today. Well, as you see, Rita, we've got questions that are not about testing as well. That's what we do when we open up these, the YouTube Live. OAG, my vitamin D level is 87. And, you know, that sounds high to a lot of people. If you look at the labs, most labs still say 20 to 40 is the right number. The level that I recommend is between 60 and 90. When it starts getting close to 90 like that, I get a little bit nervous, but I've never seen, and I've done some research in that space, I've seen problems when it gets to 110 and higher. And vitamin D, you can get too much of it, and it can kill you. So be very careful about it, but don't get higher than 90. Thank you for sharing that, OAG, and good to hear from you. Jackie Shaheen, Bob, he was speaking about HIV infections. List the podcasts. Interesting. Thanks, Jackie. Okay. OAG again. The problem most people have is they do not take enough supplements to truly do any good. Alabama, we should be eating more vegetables. Well, don't tell old Alabama Gardener that. That's what his channel's all about. He is the ultimate local farm-to-table guy. He teaches people how to do that for a living in his channel. Larry Griffiths, no man is an island, said COVID-19. Isn't that the truth? You ask for whom the bell tolls, that tolls for you. Mr. LP Joe. Oh, okay, Joe Riley. That's who Z50, Z6 is. Okay, very good. Good to hear from you, Joe. Larry Griffiths again, take vitamin K and magnesium to put the calcium to the bones, and they share enzymes. This has been a great meeting today, folks. I appreciate the interest. Again, as before, a lot of interest on this issue and in this channel. Things have gone from ugly to bad to worse, and they'll probably continue to go that way. But again, think about it. This is not the first time that we've had a lot of unnecessary death and disability. It goes on a regular basis. There are better ways to do things. We'll dig out of this just like we have dug out of many problems before, and we know a lot of the things that we're supposed to do. Again, thank you for your interest.